Live from Washington to Wall Street and covering the world, America's First News with Matt Ray is on the air.
And good Wednesday morning. America's First News continues on this 10th day of June, 34 minutes past the hour. And more than 3 months after a nursing home in Washington state became the center of the first coronavirus outbreak in the country, a majority of nursing home workers think they're risking their lives on the job, and employers aren't doing enough to protect them, according to a new union survey by the Service Employees International Union. Of course, it comes as the pandemic continues to devastate nursing homes and as some states begin to see an uptick in cases as they reopen. Let's bring in our regular guest, two-time Emmy Award-winning TV producer, a marketing and branding expert for Fortune 500, and as a manager, he built the Steve Harvey Media brand. He joins me each week to discuss money-making conversations that are happening in the real world today that affect you, your business, and your family. Rashawn McDonald, good Wednesday morning.
I appreciate always coming on the show to deliver the facts. You know, we're not trying to deliver hype. When you stated earlier, here's the sad part about that number, about only 12%. It's about 12% of the long-term care facilities still have not reported COVID-19 information. And as you expand on that statement, there have been more than 43,000 COVID-19 deaths at long-term care facilities across 40 states. Like I stated, 12% still have not reported. And we're at a running total right now of COVID-19 deaths of 114,000 so far as of this morning, Matt. And that's disturbing because of the fact that you have to have people take care of these people in these long-term facilities. And the big complaint is that we're talking about that number of 43,000 deaths in long-term or nursing home facilities. 683 are nursing home employees. And, Matt, all they're asking for are masks, gloves, and gowns. That's all.
Yeah.
And there's no support from anywhere because the White House is only recommending testing of residents, testing of employees. Nothing is ever being laid out because the lobbyists for these long-term health care facilities, for these health providers, are now enacting laws that are preventing them from being sued. So there's no accountability. Nobody's being held to a standard that says, hey, if you do this wrong, then you're going to be held accountable for this, because they're not going to be able to sue these individuals. So guess what? The numbers are only going to get higher from a standpoint of the residents who stay at these nursing home facilities, and the numbers are going to get higher for the people who care for the people at these nursing home facilities. It's a sad story that keeps mounting. As you know yourself, Matt, is being pushed further and further to the back of the headlines on evening news and national news.
And this is important because a lot of these nursing homes are getting the blame for a lot of it. When nursing homes do not detect when there's a pandemic, folks. Nursing homes do not detect when there's a virus coming their way. That's the job of the federal government and local governments as well. So, they're getting a lot of the blame.
Well, they are, and then the state and industry leaders have said that they don't have the resources to do it because there are not enough tests, nor are there enough people to administer the COVID-19 test. So it's a ping pong game. Okay, you point a finger, I got a reason that you shouldn't point your finger this way. And then when you point the finger at the healthcare providers, their lobbyists are sitting there at state and national level saying, hey, we're going to institute rules in place where you can't sue us. So you can't hold us accountable. So guess what? That means that your relative, your mom, your dad, or your uncle, or your grandfather, or your grandmother are in facilities that are not being protected by the federal government, because guess what? The federal government is only recommending that you test these facilities. And so we are in a bad situation. And when you see a number like 43,000, that's a horrible number. That's not a number. That's not a flu. Because we're comparing the situation. They try to compare the situation to the flu, that people die because of the flu. 43,000 people don't die because of the flu, and 114,000 people don't die because of the flu. So we have to realize that we have to hold not only the government accountable, but the media accountable. And we're seeing that states are now going into election mode. We have to register to vote.
We heard from Dr. Umair Shah earlier this morning, Rashawn. He is the executive director of Harris County's Public Health Department. He says he's concerned about the rising numbers in his state and in and around the Houston area, and what you mentioned, the inconsistent message that government officials are sending regarding masks and social distancing. And I know yesterday, even at the White House, the new chief of staff looked at reporters and mocked them and said, you guys look different without your masks. And one reporter said, we're trying not to die, trying not to spread disease around. So that sentiment is shared. That sentiment is shared widely. Right. But I guess the question is, Rashawn, when you're really left to do it on your own, how do you go about that safely?
Well, that's the problem that we have now. You know, I tell everybody, I am pro this country reopening. You are pro this country reopening. We just want rules. We just want guidelines. And what is happening is the state has reopened. Let's go back to, because I am from Houston, Texas, Harris County area. I'm very familiar. Judge Hidalgo had instituted masks. You had to wear masks. And then the governor Abbott overruled her. So that again, you had inconsistencies right there. Okay, should we wear masks? Should we wear masks? Okay, and so then all of a sudden, when you reopen the country, you reopen the country with no rules. And so you have people. I was in a meeting last week with some people. We social distance. I had on my mask. Two other people in the meeting didn't have on masks, and they were comfortable not having masks. I didn't understand why they didn't have masks on, but that's the way we're being lived upon. You know, HEB in Houston, Texas, they say, which is a big grocery store chain, they say, hey, you don't have to wear a mask to come in our grocery store chain to shop. You go to Costco, when you walk in the front door of Costco, they give you a mask, because they're requiring that you wear a mask. You know, the state of New York is saying you have to wear they can order you you can come in a facility and be required to wear a mask. That inconsistency is what is really boiling down to the drama that we're faced with the COVID-19. The whole thing that I talked about this last week on the show, I said, look, the stock market 3 days in a row is up. I said you will no longer hear from Dr. Fauci, and you have not heard from him. He's been pushed to the back. The COVID-19 situation is still raging out there. We knew there was going to be a spike when we reopened this country. I knew that. I'm comfortable with understanding that. But we still don't have rules in place that allow every American, every citizen, every visitor to this country to know these are the rules. That is sad, Matt. That is very, very sad.
You know, Rashawn, we bailed out the airline industry. We know there are pilots telling airlines that they have to make masks mandatory, although most are really just suggesting them. But we also know the airline industry is going to suffer until travel picks back up again. And we don't. The big unknown is business travel, Rashawn, because a lot of these companies, as we talked about, said, go ahead, continue to work from home. We don't need the real estate space downtown anymore, and everything's working out just fine. So I guess how are the dots not being connected that, you know, business travel may not pick up again? And when you have people anytime soon, and when you have people that are unsure of whether or not they want to take a flight because of the mask situation and everything else, I mean, how does this not translate into we need this for the economy to pick back up? How is that not translating?
I know we're near the end of the show. Let me just note that.
That's a long question.
I think the airline industry may be the safest form of travel for COVID-19 right now, because they're requiring you come to the airport wearing a mask. Okay, you have to get on the plane wearing a mask. The employees have to wear a mask, because prior to it, you know, it was kind of optional, and then the airline attendants were having to do the policing. And so I know people who are starting to travel now, and we always get the information late. And that's what I'm telling people now. This country is reopening. Airline travel is starting to pick up rapidly. The part of the industry is really hurting right now is the car rental industry, which is impacting the auto buying industry. That's really being damaged right now. That's what you see in the filing of the bankruptcy with Hertz and all these other companies that are being affected under the umbrella of Hertz. But the airline industry, I expect to pick up strong for 4th of July because they are put a plan in place that is going to make airline travel one of the safest forms of travel in this country today.
We're up against it, Rashawn. All of our conversations are uploaded to Rashawn's Money Making Conversations channel on YouTube. Thank you so much. We'll do it again next Wednesday.
Appreciate it. Thank you, sir.
You've got America's First News.